my name is Kristen Patton. I'm going to be presenting a PowerPoint presentation on the opioid crisis here in the United States. These are some of my healthcare workers that work with me here in the recovery room. So we all know the impact of opioids and give a lot of them every day. So I also handed out a handout to the people so they can see it because it's kind of hard to see here on my computer. Okay, so by the end of this presentation, you all have knowledge of the current opioid crisis. You will know the impact the opioid crisis has on the healthcare industry, ways to address the opioid crisis, and the economic toll that it has. You'll be able to interpret the effects of the national opioid crisis, recognize the difference in dependence, abuse, and addiction, know ways to decrease the use and abuse of opioids, and also the signs of opioid overdose. Okay, so the opioid crisis, opioid abuse, addiction, and overdose have become an increasing problem in the healthcare in the United States. Also, women are abusing opioids while pregnant, causing withdrawal in babies when they are born, known as neonatal abstinence syndrome. A little baby getting all the opioids. So opioids are a form of drug, usually to reduce pain. They're prescription pain pills: oxycodone, codeine, oxycontin, hydromorphone, morphine, fentanyl, methadone, and then illegal drugs such as heroin. So opioids are obtained by prescription written by a physician. They're usually prescribed after a major surgery or injury, and written for severe pain in like cancer patients and also chronic pain patients. Side effects of opioids: dizziness, mental fog, constipation, itching, nausea, vomiting, decreased respirations. So opioid dependence is the feeling of withdrawal symptoms when not taking the drug. Addiction is a brain disease causing someone to seek out the drug. And abuse is taking too much of the medication, obtaining it from others who have been prescribed opioids, or set in different routes, like through their nose or other ways than prescribed, or using it to get high. More than 130 people die every day after an opioid overdose. 21 to 29% of patients prescribed opioids misuse them, and 80% of patients who use heroin began by using opioids, prescription opioids. So, signs of an opioid overdose are pale, clammy skin, a limp body, blue fingernails and lips, usually caused by decreased respirations and decreased heart rate, vomiting or gurgling, and difficulty to arouse. This is just a graph showing that opioid overdose is on the rise in all parts of the United States. So it's the Northwest, the West, Southeast, Midwest, and Southwest. Southwest is actually kind of flat, but everyone else is pretty much on the rise. So what's being done about the opioid crisis? The Department of Health and Human Services, they're improving access to treatment services. Of course, the use of Narcan, which we also use here in the recovery room, but this is like out in the field. Advanced practices on pain management, so describing things other than narcotics or opioids to prevent pain. And then providing research on pain and addiction, so always research. So the impact on the healthcare industry: the cost of the opioid crisis is estimated to exceed $1 trillion after this year. It's also causing lost wages, so the hospitals are losing money on all the overdoses, so they can't pay their staff and other people. And the greatest cost is coming from the overdose deaths, because all of the treatment and everything that they're having to go through, there's no payment in the end. So, what can be done to decrease the cost of opioid crisis? The first step is prevention. So, clinicians need more education on the proper use of opioids. They need to encourage alternative medications such as non-narcotic pain medications. Opioid prescriptions are being monitored, and then the people who are over prescribing are being targeted. Higher drug tiers, so it's not as affordable to take all the opioid medications. And then also working with insurers to encourage alternatives, so have them approve things that are not opioids. So treatment, community providing support services, and then employers to provide insurance that does not have barriers to treatment. So it's really hard if someone does have a problem for them to go to treatment on their insurance. And then recovery. People need to understand the length of time it takes for substance abusers and users to recover. And then, of course, access to local support services. And that is it. Do we have any questions? All right.